So our next speaker this morning is Rachel Kenna. She'll speak about the future direction of nursing and midwifery. Rachel is the newly appointed Chief Nursing Officer in Ireland. She is registered children's and general nurse with many years of clinical and managerial experience. Rachel has worked as Deputy Chief Nursing Officer in the Department of Health since 2018 and was previously Director of Nursing in Crumlin Children's Hospital, Ireland's largest children's hospital. Rachel has a particular interest in nursing and midwifery policy, and as Chief Nursing Officer, she has a strategic role in implementing professional policy and the direction of nursing and midwifery, facilitating collaboration between government and the wider public service. Rachel is in a prime position to speak on the future direction of nursing and midwifery. Welcome, Rachel.
Good morning everybody, and thank you to the President, Karen, General Secretary Phil, Jean and indeed Michael for the opportunity to address this webinar this morning. I am going to talk to you about the future direction of nursing and midwifery from the perspective of the Chief Nursing Officer and what we can do to safeguard the future health of Irish people through the voice and skills of nursing and midwifery. And I think this year, being the year of the nurse and the midwife, is a significant year for us for so many reasons. And one of the things that it has shown us and taught us is that actually the future is never predictable. Next slide, please. Just a little bit of background just about the office and the importance of the position of the chief nurse in terms of supporting our future direction. So the Minister for Health changes with the government, but it's up to the department to keep working on the ever-evolving policies, and the chief nursing role is central within that. The current post is a ministerial appointment, and it was long and hard fought for, and it sits right in the centre of the management board decision-making table within the Department of Health. So it is in a really good position to advocate for nursing and midwife and our contribution to health and making sure that our voice is central. A very important role for nursing and midwifery throughout the whole system, but at the top level as well. So I'm right in the middle of all the business and central, and it's a critically important role in key collaborations in order to make sure that the services develop and evolve, the system develops and evolves with a strong voice of nursing and midwifery. And a lot of that voice is enabled through many of you listening this morning in your roles as directors and assistant directors of nursing. We rely on each other. We are a big unit. Everybody relies on nursing and midwifery. We know the system, we know the patient, and we know our business. So it's really, really important that we have the voice from the top to the bottom, from the patient right up to the government ear. Next slide, please. The actual office of the chief nurse in the Department of Health is small enough, but it's very busy, and we're kept busy. But it's just to give you a general idea that it is actually a partnership approach with the civil servants in terms of policy development and making sure that we are in a position to address and provide solutions to all of the challenges that come up through the Department of Health. We were actually the first unit in here in the Department of Health to have this combined approach to policy development, and you'll see a little bit later in my talk that I'll demonstrate from a leadership perspective how effective that has been, and actually other units are now modelling on the combination between the clinicians and the expertise and the civil servants working together. Next slide, please. Okay, this slide is just showing you that in order to succeed in the role of Chief Nursing Officer, you need to be many things. Among that is to be a leader, coordinating, integrating and evaluating nursing and midwifery policy, combining other units in the Department of Health, a provider, providing nursing and midwifery policy direction in line with the implementation of government policies. You need to be an influencer, building networks and inspiring general health policy across the system through the voice of nursing and midwifery. A collaborator, you need to be participating across departmental work and joined up policy development. And an innovator, implementing and embedding high-tech solutions into service delivery through retooling nursing and midwifery through expertise and clinical knowledge. Now, my point of this slide is to show that, yes, there are many aspects to the role, but this is not just about one person. It's not about the chief nurse. This is a role that relies on networks, joining the critical aspects of knowledge of the job through the voice of nursing and midwifery. And just that the directors of nursing, assistant director of nursing role are key enablers for me to be able to do this job at this level. And also then for you to be able to interpret policy in the correct way. It's really key that you're part of that, and your voice is really important to it. So it's just to show that all of the aspects of the role that are required are reliant on that network and that collaborative working approach, and that's not going to change as we go into the future. In fact, I think it's probably going to be strengthened. And that's going to be a requirement. If at the bottom there you can see the word resilience, and there's a lot of talk about resilience at the moment. But from my perspective, is the resilience piece of this is that through our collaborative approach with our knowledge and expertise, that we will continue to be able to evolve and respond to an ever-changing health service. And I think it's going to even continue to change at a fast pace as we move through the next phases of the pandemic, and also then the reform that we're about to embark on. Next slide, please. So in terms of the policy world then and leaders, what we need to be thinking about, there's certain things that COVID-19 has probably changed, but there's also problems that existed before that now may look very, very different, or there may be a different impact. There's a need for policy implementation approach that focuses on deployment and distribution to meet key care needs. It also has to focus on role development for nursing and midwifery, retention and performance of healthcare staff, all of us, to be able to deliver improved health outcomes, and enabling us to be able to perform through aligning education, skills and roles to meet population-based need. So in order to do that, we need to be thinking of things like the demographics. We all know there's an aging population and a trend to increased urbanization, actually, which brings challenges, particularly for those of you who are working in the rural areas. There's going to be a significant difference in the future if we're trying to move more care out into the community. The population of women of childbearing age is very unevenly distributed, in the sense that there has to be a change in the focus perhaps of how this is better managed. And I think the midwifery sector has really embraced this with the strategy, the National Maternity Strategy, which shows that not only have we enabled choice through this in the policy direction, but we've also enabled much better service to women all over the country. And we've a long way to go with that. The system problems are still there: access, staff shortages, waiting lists, patient flow, integrated care. They're all still there, and perhaps have been, maybe the light has shone on them even more in the context of COVID-19. We also have a lot of international themes and international sources of evidence to help us to define the future. The State of the World Nursing Report, if you haven't read it yet, is actually worth a look. And they give some interesting directions of travel that we need to bear in mind. One of the things they identified was that there is low numbers of registered advanced nurse and midwifery practitioners internationally, that Ireland actually is one of the better performers in that sphere. But I would see that actually we've proven that advanced practice at that level is really, really effective in terms of managing change and providing flexibility to our system, and really, really good patient care with outcomes that to demonstrate that. So that's something that we still need to focus on, despite being one of the leaders in that area. Safe staffing to enable the workforce is a huge policy lever, and we all know that there's a global shortage of nursing and midwifery, so we have to bear that in mind. And then obviously technology, which I'll talk a little bit more about, is a future impact that we do have to think about. And then of course COVID-19 and how that's going to change what we will do in the future, what we will have to deal with in the future, how we will care for people after the initial pandemic phases are over. Next slide, please. So as I've mentioned before, the system challenges, and just to add to that, then so many challenges are more amplified. COVID-19 has changed a lot for us. Access for patients to timely care is still really, really important. Chronic disease, managing people with chronic diseases, and people living longer, to mention but a few. Next slide, please. This slide shows some of the predictions in terms of what we're going to have to deal with for 2030. So when we're thinking about the future and leading the professions into the future, We know that we're going to have a significant increase in population of older people because people are living longer, and predicted by 2030 that 1 in 6 of us will be over 65 years of age. We will also have an increased demand, therefore, on acute beds, because we know that the majority of admissions of this age group end up in the acute hospital setting for periods of time. With people with chronic disease are going to be living longer. Sorry.
Please leave the building immediately.
Sorry, that's a normal Thursday Department of Health alarm. Apologies about that. So we are going to have more people living longer with chronic disease, and we do already have evidence that more people are living longer with more than one chronic disease. And in the context of policy, a lot of this care is going to be delivered outside of the acute hospital setting. Then obviously COVID-19 has shone a particular light on the nursing home sector, and as a delivery of care model, we need to look at nursing homes, because potentially with an increase in population of over 65, we're going to have a bigger requirement for nursing home residents. So we need to be supporting all of these aspects of care and thinking about these in terms of policy and future direction with the patient at the centre. And the only professionals in the position to lead out on that on an integrated way is nursing and midwifery. Next slide, please. The impact of COVID then longer term needs to be considered in our future direction, how we're going to manage. And this slide just shows that, sorry, these figures are maybe Mondays, but so we have over 63,000 cases of COVID-19 in this country, and we've had closer to 2,000 deaths in this country. That's 2,000, way too many deaths, and we all know that. And you've been on the front lines looking after the families and the cases, but what this slide is also showing us is that there's an awful lot of people who have had COVID-19 and that have either recovered fully, thankfully, but there are people who are still unwell, and we don't know the impact of that in terms of chronic disease management, the impact of having COVID-19 on patients with another chronic disease, etc. So we've a lot of learning still to do in terms of the future direction of care. Next slide, please. All of this is contexted in our Sláinte Care direction. So this is the future policy direction for the government. And this is definitely going to be part of our future, because Sláinte Care is a cross-party political agreement, which means for once, if the government changes, the policy direction remains the same. That doesn't mean that the direction of travel is crystal clear. And as the pandemic has shown us, sometimes the direction is going to take twists and turns. And it is a flexible policy. It does allow for that, for us to be able to prioritise where we need to focus first. But one of the main objectives of this policy is delivering care at the lowest complexity. And what that means is that we're moving to the care where it's most relevant to the patient. So accessing care for patients outside of the hospital setting and towards the community. For us as leaders and managers in the system, it's not a complete shift, but it's looking at how we can blend the settings better at the right points in order to meet the patient need. How can technology help us to do our jobs better? And that needs to be a consideration. And a big part of what we need to do is define what is required to support us as leaders and managers to deliver. And what is it that our teams are going to need to enable us as leaders in implementing Sláinte Care? So just food for thought there in terms of the overall policy context. Now, next slide, please. Nursing and midwifery, then, just to remind us of our unique value proposition that we offer as a workforce. So we're in a unique position to make it possible for us to always be leading, whether that is by the bedside or like yourselves at the top of busy organisation, complex community settings or specialist areas. It's because we have the capacity to do so. Next slide, please. I do like this slide because it just reminds us of the capacity of nursing and midwifery, setting it out to show what we can actually bring. So we can bring the bridge to gap to bridge the gap between access and coverage, we can coordinate increasingly complex care, and we have shown this. Even before COVID, we were showing this, but I think COVID has shone a light on it, how flexible we are in providing complex care. We can fulfill our potential as primary caregivers, working to the full extent of our education and training and at the top of our licenses. And we need to be in a position to enable the full economic value of nursing and midwifery contribution, showing people and demonstrating what it is that we can do for patients. And I think that has been very, very evident during particularly the last 7 months. And then changing the reference point from which nursing and midwifery is judged. So I think everybody's very aware of our contribution now to the health service, more so in the last 7 months, just because the focus has been on it, and we have not certainly let ourselves down. And as leaders, you have been very much part of our success in that for our patients. Next slide, please. So in terms of the future, we have a real opportunity to be policy setters. Policy is going to be very important for us as we move into the future. And I think we've already seen some great examples in our system of what effective policy looks like. And it allows nursing and midwifery to develop and demonstrates quickly the impact on patient care. And the reason that we can do it is because nursing and midwifery can inform practice across all layers of the system. And we're in a really good position to inform policy change because we speak the language of the patient, and our proximity to the patient makes us really good translators in terms of what is needed, what is right, and to deliver safe quality care. Next slide, please. A real practical example of the policy, practical policy, is our safe staffing framework, and that was a collaborative policy approach and really effective model. So it encompassed all the areas that you can see on the slide there. So advocating for nursing and health in a system, and navigating the political system is a really important thing in terms of policy development. This was enabled hugely by harnessing the evidence. So internationally, we knew that there was a direct correlation between patient outcomes and staffing levels. So the policy, identifying the policy issue, was better care and better patient outcomes in the context of, from a nursing perspective. Using the evidence that we had then, setting out to define with evidence what safe staffing levels would be. So we built on the intellectual, social, political and financial alliances. There was a huge amount of collaboration, and that was a Chief Nursing Office, the HSE from the services perspective, and the unions, especially the INMO, leading out together in terms of shaping the policy process. And while it took a long time to build initially, I think most of you, if not all of you, will be very familiar with the success of it, and applying a lens to that then to serve the public. So we are demonstrating as we move through the system, albeit not as quick as we want to in terms of implementing the policy, but we are demonstrating its impact and the better outcomes for patients. And we're continually evaluating it, which is a really important aspect to ensuring that policy both gets implemented on a national level and is sustained. And people have sat up and paid attention to the policy because of the way that it was developed. And I think this is the future direction. Policy in the future is going to have to build on the same model that was used for the safe staffing framework, and indeed the advanced nurse and midwifery practitioner policy as well. Next slide, please. So I suppose in terms of policy direction, then we need to think about what is important. COVID-19 has changed the world, how we live, how we work, and how we will evolve in it. And we have seen how important it is to have policies in place. So for the future then, when we're embarking on new policy direction, and it is time for that with me new in the chair, we need to look at what future policies are needed to support you doing your jobs and to support the system delivering better health. So for us embarking on that, we need to think about three aspects or perspectives really. Public opinion. Health is constantly rated as a top priority in terms of what the public want. That is going to be even more so in the future because so many people have so much awareness of their own health, of the health of the nation, and the future is going to actually require us to listen to what the public want in a much better, in a much stronger way. Cost is going to be another aspect to policy development in the future. And I think we're probably heading into a very challenging number of years. And as Chief Nursing Officer, I will have to pay attention to this, but always looking to develop policy. And I think one of the things we've learned with our previous policies is, while it is really important to look for savings, it's not necessarily cash releasing savings that we need to focus on. And through the voice of nursing and midwifery, we need to be able to articulate what we mean when we're saying savings. So talking about better patient outcomes and the ultimate impact on that, if we can keep people well longer at home, will obviously be of benefit to the services and the funding that goes with it. And then we need to build on an outcomes-based approach, focusing on data and evidence to build our profile, bank our evidence, and really demonstrate our contribution in terms of policy and policy direction. Next slide, please. I think the visibility of nursing leadership is going to be key. And I think it is about finding the best place for our voices. Including yourselves and all of our colleagues out on the front line that aren't with us today, we have a lot of leaders in the professions, which is fantastic. We're really, really lucky. Our voice is very strong throughout the system, notwithstanding the focus on it from COVID-19, but it's also the year of the nurse and midwife. And I think if ever the public were educated about our contribution, it was this year. We are really lucky to have a Chief Nursing Office position, but it is important for all of us to remember that this is a collective voice across the breadth of us. It is a powerful position, but it's more a position of influence. And I will do my very best to make sure that that is the way it stays. So next slide, please. One of the key things for the future, I think we've learned from our previous policy, is the importance of partnership and collaboration. The political system is a huge minefield. The trade unions have been great partners in terms of policy development in the past, and that's only going to have to be stronger. And then, of course, working closely with ourselves. Next slide, please. I always like this slide. It depicts an NHS caption of the health system, but I don't think the Irish health system is much different in terms of its complexity. So this is what we're going to have to manage. Throw a pandemic in on top of that, and also then massive reform in the context of Sláinte care. And that's what we're going to be leading through in the coming years. Next slide, please. These slides are going to be available. So this was just some ideas of, or some of the responses of nursing and midwifery through COVID. Important to context the flexibility and the contribution we made, but I'm not going to go through them in the interest of time this morning. Next slide, please. Because this was about the future, just to think about where we're going in terms of nursing and midwifery. So integration is key, nursing and midwifery working together, and then looking at how we can get the allied health professionals to work alongside us in delivering what is more integrated care, and having a governance model that will facilitate that, notwithstanding the fact that nursing needs to be in a position to lead. Educational regulation, we're already on the road to creating a more flexible framework, but we need to actually implement that going forward so that we can have a credentialing system as outlined in our advanced practice policy to help us to be able to respond to the system. Workforce reform, we need to continue to build on the framework and have innovative supply of solutions to safe staffing and ensure that we can continue to deliver quality care. And then technology, how can we mobilize and use technology to help us to do our jobs better? We've already seen great examples of how we have capitalized on that, but how can policy help to support that? And then finally, next slide, please. So learning for the future, the really key points for me coming out of COVID-19 in terms of what's going to influence policy direction is get the basics right. We've seen the public health contribution that we make as nurses and midwives through vaccinations, promotion and prevention, and managing chronic illness outside of the hospital setting. Innovation is going to be really key in the future. Capturing that through nursing and midwifery is going to help us to maximise the opportunity to do our job better. Integration, as I've already said, and that's not just integration across systems, it's integration with each other and how we can lead on that. Wider healthcare needs. I think if anything, COVID-19 has demonstrated that the social determinants of health, the vulnerable groups, we need to have a key focus on these areas. The real cost of healthcare is in the vulnerable groups, and these people really do need a nursing and midwifery lens to help, I suppose, get their healthcare into a better place, and nursing and midwifery then staffing and skill mix, getting this right and evolving this as we move through a much more complex system in the future. Next slide, please. Finally, just to say thank you to all of you in particular as leaders across the health system. You have enabled many great changes, but thank you then to all the nurses and midwives for the calm response, unwavering commitment, and all the personal sacrifices that have been made during this pandemic. I think in the fast moving and uncertain times, as nurses and midwifery professions, we will continue to evolve no matter what and respond to complex situations. And in order to support this, it's important to take away now the opportunity to reflect upon what has been achieved to help shape and inform the future direction of nursing and midwifery across the key areas. Thank you for listening to me, and I look forward to working with you all as we move through